What if I told you that one small handful of something sweet, something natural, something you can keep in your kitchen right now could support your eyesight while you sleep? And no, it's not an expensive supplement. It's not a miracle pill. It's a simple dry fruit. And after decades in medicine, I've seen how small nutritional habits, especially at night, can quietly protect long-term health. Tonight, I'm going to reveal the #1 dry fruit I recommend before bed for supporting healthy eyesight, especially for adults over 55. I'll explain why it works, what's inside it that your eyes desperately need as you age, how much to eat, and how to avoid the common mistake that cancels out the benefit. My name is Dr. William Thompson. Over the years, I've treated thousands of adults dealing with high blood pressure, diabetes, circulation issues, and one complaint I hear constantly is this: "Doctor, my vision just isn't what it used to be. Blurry at night,
Dry eyes, difficulty reading fine.
print, glare from headlights, and here's something many people don't realize. Your eyes are incredibly sensitive to blood sugar, circulation, inflammation, and oxidative stress, and all of those are influenced by what you eat, especially in the evening. So, let's get straight to it. The #1 dry fruit I recommend before bed for healthy eyesight is dried apricots. Yes, simple dried apricots. Not flashy, not trendy, but incredibly powerful. Let me explain why. Dried apricots are one of the richest natural sources of beta-carotene. Beta-carotene is converted by your body into vitamin A. Vitamin A is essential for retinal health. It supports the function of photoreceptor cells, the rods and cones that allow you to see in low light and distinguish contrast. As we age, vitamin A levels can decline, and low levels are associated with night vision problems and dryness. But that's just the beginning. Dried apricots also contain lutein and zeaxanthin. These are carotenoids that accumulate in the macula, the central part of your retina responsible for sharp, detailed vision. Lutein and zeaxanthin act like internal sunglasses. They filter harmful blue light. They reduce oxidative stress, and studies show higher intake is associated with lower risk of age-related macular degeneration. Now here's where timing matters. Why before bed? At night, your body shifts into repair mode. Circulation patterns change. Cellular regeneration increases. Providing antioxidant nutrients before sleep gives your body the raw materials it needs during that repair window. It's like supplying bricks before construction begins. There's more. Dried apricots contain potassium. Potassium helps regulate fluid balance and supports healthy blood pressure. Healthy blood pressure supports healthy retinal blood flow. Your retina is packed with tiny blood vessels. If circulation is compromised, vision suffers. Now let's talk about blood sugar. Some people hear dried fruit and immediately worry about sugar. That's a valid concern, but portion size is everything. 2 to 3 dried apricots. Not a bowl full, not half the bag, just 2 to 3. That small amount provides concentrated nutrients without causing a significant glucose spike, especially if eaten alone or paired with a few almonds. In fact, the fiber in dried apricots slows sugar absorption. Fiber supports gut health, and emerging research shows gut health influences inflammation throughout the body, including in the eyes. Now, let's address dryness. Dry eyes become more common after 60. Hormonal shifts, medications, and screen exposure all contribute. Vitamin A plays a critical role in maintaining the surface of the eye, the cornea, and conjunctiva. Deficiency can lead to dryness and irritation. A small nightly intake of beta-carotene-rich foods helps support tear production and surface integrity. But here's the common mistake. Candied apricots, sugared apricots, sulfur-heavy, artificially colored apricots. You want unsweetened, naturally dried apricots. They should be darker in color, not bright orange like candy. Read the ingredient list. It should say apricots. That's it. Now, let's compare briefly. Why not raisins? Raisins have antioxidants, yes, but they don't provide nearly the same level of beta-carotene. Why not dates? Dates are nutritious, but much higher in sugar and lower in vitamin A precursors. Why not dried cranberries? Most are loaded with added sugar and low in carotenoids. Dried apricots strike a powerful balance. High beta-carotene, good fiber. The #1 dry fruit revealed. The zeaxanthin king for retinal health. Potassium, moderate natural sweetness. Now, I want you to picture something. You're sitting down in the evening. Instead of reaching for cookies or chips, you take 2 dried apricots, maybe a few raw almonds. You chew slowly. You hydrate afterward with a small glass of water. Simple, intentional. That small swap reduces processed sugar intake, reduces inflammation, and supplies targeted nutrients for retinal protection. Small change, long-term payoff. Let's go a little deeper into oxidative stress. Your eyes are constantly exposed to light. Light generates free radicals. Free radicals damage cells if not neutralized. Antioxidants like beta-carotene, lutein, and vitamin C help neutralize those radicals. Nighttime is when cellular repair mechanisms are active. Providing antioxidant support before sleep aligns with that natural rhythm. And here's something many people overlook. Sleep itself is critical for eye health. Late-night screen use dries the eyes and strains the retina. So pairing dried apricots with reduced screen time, that's a powerful combination. Now, I want to make something clear. No single food is a miracle, but consistent habits matter. 2 dried apricots every night for a year equals over 700 nutrient-rich servings supporting your eyes. That's how nutrition works. Consistency, not extremes. Let me give you a quick practical plan. Step 1. Purchase unsweetened dried apricots. Step 2. Store them in a visible container so you remember. Step 3. After dinner, wait at least 1 hour. Step 4. Eat 2 to 3 apricots slowly. Step 5. Pair with darkness and proper sleep. That's it. No complexity. Now, I want to ask you something. When was the last time you intentionally ate something specifically for your eyesight? Most people think about heart health or weight, but vision is precious, especially as you age. Being able to read, drive comfortably at night, because when it comes to eyesight, especially after 60, it's not just about what you eat, it's about how your body absorbs it. Let's talk about absorption for a moment. Beta-carotene, the powerful compound in dried apricots, is fat-soluble. That means your body absorbs it better when it's eaten with a small amount of healthy fat. This is why I often suggest pairing 2 dried apricots with a few raw almonds or walnuts. You don't need much. 3 or 4 almonds is enough. That small addition can significantly improve how well your body converts beta-carotene into usable vitamin A. Now, here's something fascinating. As we age, stomach acid production can decline. That can affect nutrient breakdown and absorption. So, chewing thoroughly matters more than you think. Don't rush. Slow chewing improves digestion. Better digestion means better nutrient delivery to the bloodstream. And remember, your retina depends on a steady flow of nutrients through tiny, delicate blood vessels. Let's go deeper into why eyesight changes with age. Inside your eye, you have a structure called the macula. The macula is responsible for sharp central vision, reading, recognizing faces, seeing fine detail. Over time, oxidative stress and inflammation can damage the cells in that area. When that damage accumulates, vision clarity declines. Lutein and zeaxanthin, which are present in dried apricots, accumulate specifically in the macula. They form what's called the macular pigment. Think of it as a protective internal shield. This shield filters high-energy blue light and reduces cellular stress. The stronger the pigment density, the better protected your central vision may be. Now let me ask you something. How much blue light are your eyes exposed to daily? Television, phones, tablets, LED lighting. Even if you've reduced nighttime screens, most of us are still exposed to artificial light throughout the day. That makes protective nutrients even more important. Now, here's another: carotenoids versus vitamin A. Why dried fruit beats fresh for absorption? Benefit people rarely talk about. Dried apricots contain iron, not in huge amounts, but enough to matter. Iron helps support oxygen transport in the blood. Your retina has one of the highest oxygen demands of any tissue in the body. Healthy oxygen delivery supports healthy visual function. But balance is key. Too much iron isn't good either. That's why we focus on food sources, not high-dose supplements unless medically indicated. Food provides balance. Nature packages nutrients in harmony. Now let's address blood sugar carefully. If you have diabetes or pre-diabetes, you must be mindful of portions. 2 dried apricots contain roughly 8, 10, or 10 grams of natural sugar. For most people, that's modest. But if you eat 6 or 7, that's a different story. Excess nighttime sugar can spike glucose levels, which over time damages the tiny blood vessels in the retina. These small adaptations can mask underlying decline, which means prevention must start early before major symptoms appear. Dried apricots are not a cure, but they are a strategic addition to an overall eye-supportive lifestyle, and lifestyle is what determines long-term outcomes. Let's build a simple evening vision support routine. Finish dinner at least 2 to 3 hours before bed. Avoid heavy sugary desserts. 1 hour before sleep, dim lights. Have 2 dried apricots with a few almonds. Drink a small amount of water. Turn off screens. Allow your eyes to rest in softer lighting. That entire sequence supports circulation, antioxidant delivery, and melatonin production. Now, let's talk about something even deeper. Your eyes are an extension of your brain. The retina is neural tissue. What supports brain health often supports eye health. Antioxidants reduce inflammation. Stable blood sugar protects small vessels. Healthy sleep supports neural repair. So, when you protect your eyesight, you're also supporting cognitive function. There's a connection here many people miss. Now let's clear up a misconception. More is not better. Eating half a bag of dried apricots won't supercharge your vision. It may upset your stomach. Too much dried fruit can cause digestive discomfort due to concentrated fiber. Again, we're talking about 2 to 3 pieces. Consistency beats quantity. Now, I want to ask you a reflective question. If your eyesight improved even slightly over the next year, what would that mean for your life? More confidence driving, easier reading, clearer faces at family gatherings. Vision is independence. Independence is dignity. And dignity matters. I've had patients tell me their greatest fear isn't heart disease. It's losing their sight because it changes everything. Small daily nutritional strategies are powerful because they're sustainable. They don't require drastic change, just intention. Before we move forward, let's briefly compare dried apricots with another contender people often ask about, prunes. Prunes are excellent for digestion. They contain antioxidants too, but they are not particularly rich in beta-carotene. Their strength is gut health, not retinal pigment support. Apricots remain superior specifically for vitamin A precursors. Now here's how this snack stabilizes the tear film to prevent morning dry eye. Advanced tip. If you want to enhance eye support even more, include leafy greens during the day. Spinach, kale, collards. They're high in lutein and zeaxanthin. Then use dried apricots as your targeted evening edition blood flow because your eyes don't just need vitamins. Now I want to touch on something deeper. Light exposure. First thing in the morning. Natural sunlight within 30 minutes of waking helps regulate circadian rhythm. A strong circadian rhythm improves sleep quality at night. Better sleep improves cellular repair. Improved repair supports retinal health. So protecting eyesight isn't a single action. It's a rhythm. Morning light, daytime movement. Balanced nutrition, evening calm, nighttime darkness. When those elements align, your body functions more efficiently. Now, let's circle back to dried apricots for a moment. Their potassium content supports vascular relaxation. Balanced potassium intake helps counteract excessive sodium. Sodium can elevate blood pressure. Excess pressure damages small vessels. So again, the benefit isn't isolated, it's integrated. But remember, dried fruit is concentrated. Moderation is everything. Now I want to ask you something important. When was your last comprehensive eye exam? Not just a vision test for glasses, a full retinal exam. Many eye conditions progress silently. Glaucoma, macular degeneration, diabetic retinopathy. Early detection makes a difference. Nutrition supports prevention, but screening supports early intervention. Both matter. Let's talk briefly about omega-3 fatty acids. While dried apricots provide carotenoids, omega-3s from foods like walnuts, flax seeds, and fatty fish support tear production and retinal membrane integrity. If you pair your evening apricots with a few walnuts, you're layering benefits. Again, small amounts, intentional combinations. Now, I want to speak directly to you. If you're over 70, it's easy to assume decline is inevitable. That worsening vision is just part of aging, but aging and degeneration are not identical. You cannot stop time, but you can influence the speed of functional decline. Every protective habit slows the curve. And slow decline means more years of independence. Let me paint a picture. You're 80. You're reading comfortably, driving during the day without hesitation, recognizing faces clearly. Those abilities are built now in your 60s, in your 70s. through daily choices. This isn't dramatic. It's incremental. But incremental decisions compound. Now let's simplify everything we've discussed into a practical daily blueprint for eye support after 60. Morning, get natural light exposure within 30 minutes of waking. Midday, eat leafy greens rich in lutein and zeaxanthin. Afternoon, stay hydrated steadily. Evening, take a short walk after dinner. 1 hour before bed, dim lights. Have 2 dried apricots with a few almonds or walnuts. Avoid screens. Sleep in darkness. That entire routine supports circulation, antioxidant protection, circadian rhythm, and cellular repair. No extremes, no complicated protocols, just alignment with biology. Now, I want you to reflect for a moment. Sleeping with the television on or falling asleep with bright lights in the room, it sounds harmless. Background noise, a little glow, comforting even. But your eyes are not meant to process light all night long. Even when your eyes are closed, light penetrates your eyelids, and your brain detects it. Here's why that matters. Your retina contains specialized cells that respond directly to light. These cells help regulate your circadian rhythm, your internal clock. When light hits them at night, even faint light, it signals to your brain that it's not fully dark. Melatonin production decreases, and as we discussed earlier, melatonin is not just a sleep hormone. It's a powerful antioxidant. It helps protect retinal cells from oxidative stress. So if you sleep with the TV flickering in the lipid rule, why you must eat 3 walnuts with your dry fruit, background or a bright hallway light spilling into your room, you may be suppressing your body's natural overnight eye protection. Now think about this. The average television screen constantly changes brightness and color. Even with your eyes closed, that fluctuating light creates subtle stimulation. Your brain remains partially alert. Sleep becomes lighter. Repair becomes less efficient over months and years. Reduced melatonin exposure at night has been associated with increased oxidative stress. Oxidative stress contributes to macular degeneration and other age-related eye conditions. Let me ask you something directly. Is your bedroom truly dark? If you can see clearly across the room without turning on a light, it's probably not dark enough. Your body evolved in near total darkness at night. That's the environment in which cellular repair functions optimally. Here's a simple test. Tonight, turn off every light source. No television glow, no standby lights, no illuminated clock faces. Wait 5 minutes. Allow your eyes to adjust. If you still see outlines clearly, there's light leaking in. Consider blackout curtains. Cover LED indicators. Use a sleep mask if necessary. Complete darkness improves melatonin levels significantly, and that benefits both heart and eye health. Now, let's address another hidden nighttime strain on eyesight. Reading on backlit devices in a dark room. This creates extreme contrast. Bright screen, dark surroundings. Your pupils constantly adjust. Your eye muscles work harder. Blinking decreases. Dryness increases. Over time, this contributes to digital eye strain. If you read at night, use a soft lamp behind you or beside you. Even lighting reduces strain. Better yet, switch to printed books when possible. Paper reflects light more naturally. It's gentler on aging eyes. Now, I want to discuss something subtle but powerful. Sleep position. If you consistently sleep face down with pressure on one eye, intraocular pressure can increase slightly during the night. Over years, repeated elevated eye pressure may contribute to glaucoma risk in susceptible individuals. Try to sleep on your back or side without direct pressure on the eyes. A supportive pillow can help maintain alignment. These are small adjustments, but small adjustments accumulate. Let's talk about air quality. Dry indoor air, especially during winter, worsens eye dryness. If you wake with irritated or gritty eyes, consider a humidifier in your bedroom. Balanced humidity supports tear film stability. Healthy tear film protects the cornea and maintains visual clarity. Now, here's something else rarely discussed. Late-night emotional stress affects eyesight indirectly. Stress increases cortisol. Elevated cortisol over time can influence blood sugar levels. Blood sugar fluctuations affect the lens inside your eye. When glucose rises, the lens can temporarily swell, causing blurry vision. Have you ever noticed your vision seems blurrier during periods of high stress? That's not coincidence. Your eyes respond to systemic changes quickly. So, calming your nervous system before bed protects visual stability. Now, let's zoom out again. Healthy eyesight after 60 depends on 5 pillars: circulation, antioxidant protection, blood sugar stability, sleep quality, and reduced strain. Dried apricots support antioxidant protection and micronutrient supply. Evening walking supports circulation. Reduced nighttime light supports sleep and melatonin. Balanced portions support blood sugar stability. Environmental adjustments reduce strain. When these pillars align, you create a protective environment for your vision. Let me ask you something important. Are you reacting to vision decline or warning? 2. Healthy dry fruits that are actually high sugar eye killers. Actively preventing it? Prevention is quieter. It doesn't feel urgent, but it's far more powerful. You don't wait until severe blurriness appears to care about your eyes. You build protective habits early. Now, let's make this extremely practical. Here's your 7-day eye health reset. Day 1. Purchase unsweetened dried apricots and raw almonds. Day 2. Take a 10-minute walk after dinner. Day 3. Remove television from the bedroom or commit to turning it off before sleep. Day 4. Install warm-toned bulbs in your bedroom lamps. Day 5. Ensure your bedroom is fully dark at night. Day 6. Practice 5 minutes of slow breathing before bed. Day 7. Schedule or confirm your next eye exam if it's overdue. 7 days simple actions. No overwhelm. By the end of that week, your evenings will look different, calmer, more intentional, more aligned with how your eyes were designed to function. And here's the truth. Most vision decline is gradual, which means improvement in habits is gradual too. But gradual change is sustainable change. I want you to imagine a year from now, you've consistently eaten 2 dried apricots at night, walked after dinner, protected your sleep, reduced nighttime light. How many hours of oxidative stress have you prevented? How many nights of deeper repair have you accumulated? That's powerful. Before we wrap this segment, I want to hear from you. It's the result of cumulative stress, cumulative inflammation, cumulative vascular strain, and cumulative neglect of small daily habits. But here's the encouraging part. Cumulative protection works the same way. Small daily deposits build visual resilience. Let's talk about something that doesn't get enough attention: contrast sensitivity. As we age, we don't just lose sharpness, we lose the ability to distinguish subtle contrasts. This is why driving at night becomes harder. Headlights seem blinding. Street signs look washed out. Lutein and zeaxanthin found in dried apricots and leafy greens help improve contrast sensitivity by strengthening the macular pigment. That's not just about reading small print. It's about safety, about confidence, about independence. Now let's address a concern some of you may have. What if I already have macular degeneration? Nutrition still matters. While it may not reverse advanced damage, antioxidant-rich foods support remaining healthy cells and may slow progression, but consistency is critical. Skipping days won't produce meaningful impact. Steady intake over months and years makes the difference. Now, I want to pivot slightly because eyesight is not just physical, it's neurological. Your brain interprets what your eyes detect. If sleep quality is poor, visual processing can feel sluggish. Have you ever noticed that after a restless night, your vision feels slightly off? Maybe not blurry exactly, but less